All right, call into order Communications Advisory Commission meeting today, March 1st, 2021. Approval of the agenda. Can I get a motion?
Motion to approve.
All right, got a motion on the floor. All in favor of approving the agenda, say aye.
Aye.
All opposed, say the same. All right, approved. Next, approval of minutes. Can I get a motion?
Motion.
All right, all in favor of approving a minutes from last meeting in January, say aye.
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 Okay, all opposed, say the same. Minutes approved. Public comment. Any public comment today?
We did not receive any.
All right, then moving on, staff report.
So our staff report for the activity of February. Did I send you the right one? Did I send you the wrong one? I realized that the one in your packet has the wrong dates on it, but I think I sent you the right one. In any case, so we're still dealing with COVID. That is still a part of what we do. We are reaching that 1-year mark of those first announced cases in Johnson County. I still keep a copy of the last community activity guide that we did right before at the very end of February, beginning of March last year. And it is really amazing just to sort of look back at that and sort of see what we'd all planned for summer and spring break, and just how much that changed. It continues to impact, obviously, what we do, what we communicate, what we talk about. Spending time and effort helping to amplify the Johnson County Public Health messaging. We also did some work just to reiterate the local urging to maintain masking and other mitigation here in Johnson County after the governor rescinded some of her mandates. We did a little bit of outreach to help connect some seniors with a vaccine clinic that was happening in Solon just the end of last week. And we'll continue to look for those opportunities to help direct people towards vaccination appointments as those opportunities arise. We finished up Beat the Bitter, which happened at the very end of January, beginning of February. Our big takeaway, it was all free programming this year. It was obviously much different than it's been in years past. But we did it with very conscientiously of how can we keep people safe? What can we do that's safe? And what can we do that we know that they'll be able to count on this winter? And we were really pleased with the programming that happened. We were really pleased with the response that it got. Folks went out and seemed to really enjoy having an opportunity, having something to do, and going out and seeing those ice sculptures out at Penn Meadows Park. Those couple of nights we had them out. We lit them. We ended up lighting them. We planned to light them 2 nights. We lit them 2 nights, but the 2 nights that we lit them changed due to the storm that we had that rolled through that one weekend. We gave people an opportunity to get out and do that 5K. Angela McConville did a really nice job with a we call it the I Did a Pod race. It was a little bit of a scavenger hunt with some opportunities to learn a little bit about North Liberty's history. And some activity kits and some other things through that week. We're going to continue to look at opportunities to do similar things through the spring and summer, as well as think about things that we can that people can count on, that we can adjust some of the precautions based on the public health situation at the time too. So we'll start talking about booze and barbecue. We'll continue to have some internal conversations. We're going to have some more as we sort of figure out what exactly is going to be the right path for us. It's obviously the biggest, trickiest part for us is figuring out where are we going to be at in July, and what can we do that's prudent, that doesn't waste staff time and raised money. But also we want to, what that also honors what that event is, right? Which is a free day of fun for our community. So we've got some ideas, and we're going to continue to kick some of those ideas around and chat with folks on the committee, continue to talk with folks who've sponsored the event in the past, as well as other programming staff at the city. And we've got kind of an inkling of a plan, but we need to have some more of those conversations. The Great Neighborhood Initiative is going well. That obviously came out. We worked on that, but really sort of announced it, that slate and all of those folks at the beginning of February. We've been using them to sort of help us communicate again some of those things. We reached out to them, for example, as we started to build that list for seniors interested in vaccines, so that we could help make those connections, as well as just a variety of other opportunities for them to learn more about the city and help us remind other folks in our community about those opportunities. So far, we keep reminding them that we're learning as we go, and we need their feedback, and they seem to be perfectly happy to tell us and give us feedback too, which is great. We obviously had a lot of snow early in the month. It was identified by some of our streets crews as some of the worst conditions they've ever dealt with. Doing a lot of warning sort of through that storm to help people know what areas to avoid. Really urging people to stay off the road. And we're going to continue that worked pretty well. The only other thing I'm going to flag is that starting in March, each Friday, we're going to do a project open house, virtual one, focusing each week on a different project. Years past, we've held these in person at the library. That's obviously not going to work. This has an opportunity, I think, to be a really neat format because we can record these. It's a webinar on Zoom. People can come over lunch if they can submit questions in advance or ask during the event itself. We'll record them and they can come back and watch them later and follow up with us, as opposed to having to come and stop by a physical place on one afternoon or one evening. So this week we'll be talking about parks in particular, some plans for Penn Meadows Park, for Centennial Park, and then some trail plans. There's going to be an opportunity to talk about those specific things in those parks, which is like resurfacing the tennis courts, but also to talk more broadly about some of the master plans for those parks going forward. I think that's what I've got for you tonight. If you have any questions, I'd be happy to answer.
I have a question about just our communication, what platforms that we're using. Yeah. How is it going on Nextdoor?
You know, it seems to be going fine. We've been posting there a little more frequently. We treat it differently than we do Facebook or Twitter. On Facebook and Twitter, we share something every day. That's a place where we'll post links to like local media stories that relate to North Liberty. We don't do that with Nextdoor. Nextdoor really do focus on announcements, and particularly on things that members of the community can directly take action on. It sort of is kind of, I think, the difference there. We don't see a ton of engagement there. It really depends on what we're doing. It does have an opportunity to, it has a built-in emergency alert feature where if we push that button, it depending upon the settings that the community has set up, they can get texts or emails that push right away as opposed to that daily digest. We've used that for really big snow emergencies. We used that the other day when we had the active police incident over there on Cherry Street, just to get a little bit of a word out a little bit faster. We don't get it. We get some likes and engagement. It's still something I think we're trying to figure out how best to do. One of the things it's a blessing and a curse is that we can't see into the conversations that neighbors are having with themselves. We only can see our posts and the posts and the comments on there. So if somebody's misinformed somewhere and has a big question and we can't see that, and that's one of our goals again with the neighborhood ambassadors, that we have those folks who are neighbors who can see those things and who can help alert us or answer those questions for their neighbors.
Is there possibility of utilizing Clubhouse in the future?
Well, as Jillian and I are on Clubhouse and have been playing with it a little bit, I think it could be something kind of fun and cool. I think if nothing else, there's going to be additional sort of audio social media, whether it's Clubhouse or whether it's, you know, the platform that Twitter's building out or that Instagram's building out, that might be sort of an interesting kind of talk radio thing that's not produced audio that might work and be kind of fun to play with and see what that does for us.
Cool.
I have two questions if you have a second. You mentioned that you worked with Johnson County Public Health on their COVID hub. The state of Iowa it is the first, and as far as I know, the only state that's no longer reporting county level COVID information.
Yeah.
And I've tried to go to the public health hub a few times, and I find it very awkward. Is there another source to go to that's better or easier to use?
I'm unaware. You know, Tom, I'm unaware of a better source. That is a disappointment. I know for a lot of folks who have been tracking this data, and I know that you've been tracking the data personally since early in the pandemic. And I don't think you're alone in that frustration. I can certainly ask and see if there's a better opportunity. My guess is that the way the testing all gets reported, that it would be difficult to get something more specific, get better data again.
Well, it would help if we could still continue to get at least the total number of cases.
Yeah.
And at one point there was a way to download the data, the raw data, so that you could backfill where it's been missed. But yeah, that's kind of a frustration. All right. Well, the other question deals with the spring cleanup. Do you have any updates on how that's going, or if it's going?
I don't have an update yet. I did flag it. We did get a question the other day. I did flag it for our staff that we need to at least have a conversation with what that looks like, but I don't have an update for you.
Okay.
But as soon as we have an answer, whether that's doing something similar to what we did back in the fall, where we issued vouchers to folks who requested them, or additional trash stickers, or if it's holding the traditional day, we'll let folks know.
Okay, thank you.
I remember last year around this time, there was a kind of a bigger issue with, or not big, but we talked about it anyway, people parking on the streets and helping get the word out, and the public expectation that you would let them know each time versus one time. Did that seem to get better this year?
Yeah, I think, you know, we've worked pretty well with streets, and I think we've got a good rhythm down for when we declare. We try to really avoid making those declarations unless we know that we're going to get heavy snow. So we don't. Nobody wants to be the people that tells you to stay off the street, and then, you know, you get kind of a sprinkling of snow and you feel like a dork. When we have gotten to that point where we've needed to make a declaration, we've tried to push it a lot louder. And we also recently built out a page that was a little more specific about where, just so that people would know exactly where they could find that information. It's one thing that, like, we do push it into a lot of spots, right? So we publish it on Facebook, we tweet about it, we put it on the website, we put it on every page of the website, we put it on Nextdoor, we send it to the media. But at the same time, right, if somebody uses, say, listens to Iowa Public Radio, they're not going to get it in the same way that somebody else would. So we're trying to make sure that folks know exactly where they can go for that. There's still, of course, trouble spots. Our streets folks report that there's spots where they know there's just going to be folks parked on the street. I think, you know, we've talked about ways to remedy that by doing some more pointed outreach to those areas. If they let us know where those folks are, and we can talk with, we've got neighborhood ambassadors that can maybe help us out. We can maybe consider letters, something that's a little more targeted. And that's probably the next step for us.
Does anyone have anything else? Comments on staff report? All right, then moving on to the next agenda item, old business. Does anyone have old business they want to talk about? New business.
I'd like to make a suggestion, and I don't know exactly where this would lie. We've been, since we're over 65, we're
Yeah.
working quite. We worked. My wife found a resource for vaccinations.
Yeah.
And you have to go online at 1 a.m. and contact CVS Pharmacy.
Yeah.
In Cedar Rapids to get vaccinations, and we
Yeah.
got them right away.
Good.
There was talk about Walgreens having their website, able to take, and we tried going there, and it was just Walgreens apparently just got bombarded with all kinds of traffic.
Yeah.
So I'm wondering, is there anything that North Liberty can do, or is there about that?
So there's obviously there's a few resources out there, and it's tricky because the centralized hub isn't great. This is one of the things that we've publicized and certainly on I recently updated our COVID page on our website to help people to get directed towards those sources for vaccines locally, whether that's Hy-Vee or Walgreens, Towncrest and Solon, and a few of those other spots. We do have a link to the state of Iowa's site, which is vaccinate.iowa.gov. That's a site that links to everybody else's sites, which there is no really easy, unfortunately, centralized hub for I need a vaccine. Where can I get one that's closest to me and sign up for it? It is a lot of hoop jumping. We're trying to build a list of local folks who need those, so that if those opportunities arise for a mass clinic in North Liberty, that we are at a place where we can help connect those folks. We're also just trying to remind folks of where they can go to find the information of who's offering vaccines, whether that's UIHC or again Walgreens or some of these other spots. But Mike, you're absolutely right. It's a frustrating. You're not the only person I've heard frustration about Iowa's vaccination program. I was talking with my stepmother-in-law who was frustrated, and she's been waking up and doing it sounds like doing the very similar sort of rigmarole that you're doing. And the best I think we can do is to continue to make sure that folks are aware of where the centralized hubs, such as they are, where those exist.
Well, we were successful at getting
Good.
appointments, so we're
Good.
very pleased with that. We already have our first vaccination, and
Good.
2 weeks from now we get the second one. So
Well, very good.
But I think this is going to be a trend, though, don't you think?
Yeah.
I mean, even when they get into the younger folks, I don't know how.
Yeah, I think so. I mean, the nice thing is we know that, for example, UIHC is doing mass vaccinations at their site just south of Forever Green Road, and they're trying to build up to about 5,000 vaccinations a day. So the folk, we have people locally who know how to do this and know how to do it a lot. Last week, the clinic in Solon over a Friday and a Saturday, they did more than 1,000 vaccinations. So the expertise is out there, and my hope is that, of course, as supply increases, that it'll be easier to get those appointments, right? That people's providers will let them know, and that we'll have the expertise to just do mass vaccination.
Thank you.
The university operation down by the Forever Green is a very smooth operation. They do a great job. I got my shot last Wednesday, and they were very efficient.
Great.
They also notified me that my wife was registered with them, and she's not gotten an email yet telling her to register. She's got a shot somewhere else, but so they're using some sort of lottery system.
Yeah.
But once you get your reservation, it was 2 days after I got my email that I got my shot, and it took 10 minutes in and out, and 15 to sit there.
Tom, I have a question though. did you have to register online, or were you able to call in to register?
I registered online.
Okay.
They sent an email out to people who were, to people who were patients of the university clinics and asked if we were interested in getting a vaccination. So I said, yes, I am. They also said that even if you're not a patient of one of the clinics, you can register and tell them that you're interested, and they'll put you in the same pool. So then they sent me an email, and I immediately responded to that, and there were lots and lots of spots open. I don't know what their condition is now, but they had many reservations that you could get.
The only thing I think about, sorry.
Go ahead. I'm sorry. No, go ahead.
Is the barriers to those who
Yeah,
don't have internet access. And have you provided any type of communication, or has anyone reached out to the city, just regular, phone calls, like, I don't have access to internet and I don't know how to navigate to get a vaccination?
Yeah, that's a great question. So with the clinic that was hosted in Solon, we used our neighborhood ambassadors, and we reached out to the folks there at Keystone and at North Liberty Living Center. And Angie went and knocked on doors up at Jefferson Point. And she really prioritized doing the on the ground work to get those folks signed up. And it sounded, and she reported back really positive results from the contact she was able to make. So we know that there's more work to do. We do have stuff from Johnson County that's translated to help us get past some of those language barriers that we'll start using too. The county's meeting with a bunch of social service providers and cities and other partners every week, just to sort of to work on what are the things that they can do. How can we make sure that we're vaccinating equitably, because that is a concern.
All right. Anything else from the commission regarding new business? All right. Adjournment is next.
So moved.
Second.
All right. Vote. All those in favor of closing out this meeting, say aye.
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 All those opposed, say the same. Meeting adjourned.